So I wouldn't blame you if you're thinking, come on, medical school? You really are telling me that I can major in speech communication as a way of going pre-med? But let me tell you a little story. There was a student at Northwest Christian in the early 1990s by the name of Joe McDaniel. Now, Joe was a service brat, so he had moved with his family around the country and around the world, and he didn't really call any place home. But when it came time to pick college, right around then, he met the love of his life, and they made plans to get married. But she wanted to move back to the Pacific Northwest, and in particular, she wanted to move to Eugene and to go to Northwest Christian, and she wanted him to come with her. And he said, but I can't do that. I want to be a doctor, I want to go to medical school, and if I'm going to get into a good medical school, I need to be out on the East Coast. I need to be at one of the Ivy League schools. Well, he wound up following his heart, and when he got here, he actually chose speech communication as his major. Now, he didn't study with me. He studied with a professor by the name of Lee Lane, who's a little bit of a legend on this campus. I am not the teacher he was, although I try every day to follow in those footsteps and I try to get better at it. But Lee Lane was the professor that Joe McDaniel worked with, and Joe studied interpersonal communication, nonverbal communication, listening behavior, conflict management, all of these areas and all of these skills that we teach in the speech communication major. What he also did is he took all the math and science he could get his hands on, both on our campus and across the street at the University of Oregon. And then, when it came time to apply to medical school, a number of the medical schools did interviews, and what he talked with them about, he talked about what he had studied as a speech communication major and how it applied to being a doctor. How a doctor needed to be a good listener, how a doctor needed to be a shrewd judge of nonverbals. And the pre-med advisor over at the University of Oregon, who had worked with him a lot, was very pleased to say that he got his admission to 2 very prestigious medical schools before any of the University of Oregon pre-med majors got accepted to even one. So it certainly can be done. Now, in the interest of being honest with you, which I always try to do, the traditional, typical path to going pre-med and preparing for medical school is to major in a science. And a lot of students at Northwest Christian major in exercise science as their way of going pre-med. So that might be the right major for you. But if it's the case that communication just fascinates you and you've always wanted to learn more about it, and it's the kind of thing that would motivate you, the kind of thing that would drive you, and you sort of find the idea of majoring in it enticing, but you've always wanted to be a doctor, and you're having trouble reconciling that tension, what I want to do in this video is I want to make the case to you that it can be done, that you can major in communication, you can prepare yourself to be a top-notch, competent, effective communicator, and you can take that on to a career in medicine. So where I want to begin with that is I want to talk to you about the agency in the United States that accredits all of the medical schools, from Harvard and Johns Hopkins on down. It's called the Accreditation Council of Graduate Medical Education. And they have 6 learning outcomes that they want every medical school to show them that their student doctors are achieving by the time they finish up the program. Now, most of them are the kinds of things that you would expect, that they have skills in diagnosis, skills in running a professional practice, they have medical ethics straightened out, but one of them you might find surprising, and it's only been around since 1994. They want for student doctors to have excellent interpersonal communication skills. As a matter of fact, what's become a standard practice in just the last few years in the licensing examinations is that student doctors do a session with a standardized patient. They train a person to come in to behave as a patient, have the student doctor examine, have an appointment, a virtual appointment with the standardized patient. The standardized patient then scores the doctor on their interpersonal communication skills. You know, did they listen? Did they ask questions appropriately? Did they show affinity and warmth? Did the standard patient feel welcomed and safe in the encounter? All of these things that we address in interpersonal communication classes. Now, that learning outcome was the most recent one added. It was only added in 1994, which was probably within your lifetime. And medical schools know the least about how to teach it, and most of the faculty at a medical school really don't have the training. They know in kind of a rough way what it looks like when it's done well, but how to teach it, how to impart that knowledge, how to build up those skills is a little bit of a mystery still, and there are a lot of medical schools that are scrambling to figure out how can they get better results on this learning outcome. And what that means is, at this moment in history, a student who comes in with a degree in communication, speech communication, who also has all the preparation in math and science, who's made it through organic chemistry, can be a very competitive candidate for admission to a lot of medical schools. Some of the more recent research, the American Medical Association launched an initiative in the mid-2000s. They called it the Initiative to Transform Medical Education. And the report was issued in 2007, and one of the major recommendations was that medical schools weren't quite there yet, that they still needed to build up the communication skills that student doctors were leaving with. So when the American Medical Association's holding that over the heads of some of these deans of medical schools, and your application comes across their desk, and you're a student with very high grades and a very high MCAT score, and the math and the science that shows that you're not being set up to fail if you start medical school, but that you're also an effective communicator, then you're the kind of person that they want to see in their medical school class. A 2008 survey done by the American Board of Medical Specialties sent a survey out to a lot of people asking them what went into choosing their doctor and what went into their level of satisfaction with the doctor that they'd chosen. 95% said that communication skill was an important factor in their choice, which was higher than any other measure. It was chosen as very important by more people responding to the survey than anything else. Dr. Kevin Weiss, who's the president of the board, said that communication skills are increasingly recognized as an essential component of quality healthcare. Patients are demanding that doctors treat them not just with medicines and procedures, but also with empathy and with information that they understand. University of Pittsburgh Medical School has actually opened up a program called the Doctor-Patient Communication Initiative. And Dr. Robert Arnold is the director of it. And what he said is, despite all the scientific advances in medicine over the last century, doctors are still sitting down and talking to patients. That's the most common and one of the most effective things that they do. And he went on to say, the particular diagnostic questions they ask may change as advances are made in the basic science, but the process of communication will stay fundamentally the same. And what we teach in the speech communication program here are those fundamentals. So, well, one last thing that I want to say before I get on to what advising would look like. If you came to me and you said, I want to be a speech communication major, but I plan on going to medical school. Let me talk a little bit about the particular areas of application if you wanted to be a doctor, so you can keep those in the front of your mind as you're making your own choices for your college education. The particular communication skills that medical students are encouraged to develop are, when you meet a patient, how to get information from them, how to find out, because often the first thing that they talk with you about when they're in the examining room is not what really brought them in that day. So it's about how to be patient, how to start a conversation, how to build up their comfort level, in particular to build trust, because a lot of medical conditions, a lot of symptoms are embarrassing. And there has to be a level of trust before a patient's going to open up to you and tell you what's really going on. And also, how to, in talking with a patient, how to educate them, how to help them understand what's going on, to meet them at their own level, and to make your treatment plan, to make your recommendations understandable enough and appealing enough that the patient will actually pursue them. Doctors who are rated as very competent communicators report that they have greater patient satisfaction, that there's better adherence to treatment plans, that patients are more likely to follow doctors' instructions, that they had better outcomes with difficult patients. Because not every patient you have is going to come in, be very coherent and glib and fluent in telling you about what their problem is and be cheerful and compliant. Some patients are going to be very tongue-tied, some patients may be oppositional, and some patients may be just plain terrified. But the doctors who are good communicators are the ones who can get past those obstacles and help the patients who are not exactly easy to work with. It's also the case that there are fewer medical errors when doctors have better communication skills, and there are fewer malpractice cases. And one of the issues that just in the last few years has really become important to people operating medical schools is there have been some studies that found that when there is a difference in cultural background between the doctor and the patient, that uniformly you can expect worse medical outcomes, that those patients are less likely to report satisfaction and they're less likely to recover from whatever it is that brought them to the doctor's office in the first place, or to stay healthy if it was just a wellness visit. So what we do in the communication field is we teach intercultural communication, we teach mindfulness. How is it that you can see people who are from different backgrounds, different heritages, but talk directly to them? Take a lot of your preconceptions out of the way, take down your perceptual filters, and approach them honestly. Not try to fill in what you expect they're going to say, not treat them out of your stereotypes, but see a person in front of you. Finally, two areas of communication in which it's really, really important for doctors to have very good communication skills. One of them is palliative or end-of-life care. When you get people who have terminal illnesses where treatment isn't really going to help them recover, but what you want to do at that point is you want to ease their pain. People who are in palliative care, doctors in palliative care, really have to have excellent communication skills, because reporting on the level and nature of pain and helping them with the treatment regimen, that's the kind of thing where there's still enough uncertainty involved, there's still enough of a learning curve with the medical profession in general that communication has to fill in some of the missing clues. It's also the case that there's all sorts of research saying anyone who's going into the field of oncology, anyone who's going to go into cancer treatment, really has to have excellent communication skills, because they have to talk about levels of risk, levels of probability, they have to talk about what is going to happen in the treatment regimen, and they have to be very, very careful. And they have to get across concepts that are sometimes kind of nuanced and sometimes kind of hard to pin down. And so the oncologists who have the background and the preparation to be really good communicators, those are the ones who are really, really going to be able to reach their patients and treat them well. So if you came to me and you said, I want to major in speech communication, but I want to go on to medical school, here is what the advising would look like. The first thing is that Northwest Christian University offers an associate's degree in pre-professional health sciences, and for your core, for you doing all of the undergraduate stuff, we would put you into that track, because that's going to get you into some of the advanced science classes. And it also doesn't look bad on your transcript when you have that associate's degree, and so it shows to a medical school that there's a level of commitment to you going into this profession. We would also make sure that you proceeded in your science classes as far as organic chemistry, because that shows to medical schools that you've got the level of background knowledge to where you don't have to make up a deficiency before they'll admit you. So it's possible that we would have to negotiate with Lane or work with the University of Oregon for the classes we don't offer on our campus. But we wouldn't leave that to chance. We would make very sure that you had the science preparation that was going to get you admitted. As far as your communication classes, we would put you in the interpersonal communication track, because there may be some situations where it's helpful for you to get up in front of an audience and talk to people. You might wind up in public health. But really, if you're going to be a practicing physician, what's going to help you a lot more is really strong interpersonal skills. So we would make sure that either you could take as an independent study, or if we had enough students interested in going on to medical school, we might actually offer it as a full class, a class called Health Communication, which is fairly standard on college campuses all across the country, and I feel perfectly comfortable teaching it. It's interpersonal communication, but particularly in the healthcare system. And how do you talk with patients? How do you build up that trust? How do you show the kinds of immediacy behaviors that are most effective in a doctor-patient environment? We would also make sure that you did multiple internships. Every student at Northwest Christian University completes an internship as a requirement for graduation, but there's no reason you have to stop at one. So along the way, we would make sure as often as possible that you could get into healthcare settings, you could get into doctor's offices, quite possibly in different areas of specialty, so that you could take what you were learning in your communication classes and you could make the connections all the way along the way. So that's a little bit of an overview, and that's a little bit of an introduction to how, if you've thought of yourself as a doctor and that's the career you want, but you've also been attracted to the idea of majoring in speech communication, those are compatible. It's not the most typical, it's not the most traditional way into medical school, but there are some ways in which, if you follow this path, you become an especially attractive candidate, especially because you would not be the typical candidate. So think on these things, and any questions that you have about this, I certainly am willing to field. Just let me know what they are.